Today, we are going to look into a case note of Sarah Marshall. As usual, we can see the writing task first. See here. You can see that you are going to write this letter, which is a formal letter to the nursing director, Jane Hall of Southern Valley Community Transition Care Program, QLD 4101, mentioning Miss Marshall's continuity of care at home after the discharge. Here, we got the recipient name as Jane Hall, and she's a nursing director, and we understood that it is a formal letter to Jane Hall. Then, we got the purpose of the letter as the patient's continuity of care at home. So, this is the purpose. That is, the patient's, Miss Marshall's continuity of care at home. Now, let's go to the top of the case note. Here we can see that you are a nurse practitioner at Medical Center, Brisbane. Then, we can see the patient's details below. It says that date of birth as August 14th, 1941. And the patient's address is given here. Name is Sarah Marshall. And it also says that Marshall's next of kin is her adopted son, Mr. George Simmons. Then down they have given the social history. Here it says that Miss Marshall is a retired professor and she is a widow, and she stays with her adopted son in one-story house. Her husband died in 2009, but her son is often unavailable to take care of her because of his school and work. Moreover, it says that oxygen is readily accessible at home via nasal cannula at 2 to 4 liters as needed. Then down we can see her medical history. Here it says her height and weight. And also we can see that she is an occasional alcoholic beverage drinker. She used to take 1 to 2 bottles of beer a week. She is also a smoker, and she smokes almost 10 to 15 cigarettes a day. She was smoking for 35 years. Moreover, it says that she has never done any surgical procedure so far. The medical history says she was diagnosed with COPD in 2006, and she has been diabetic since 2002, for which she is on medication. And she has also been hypertensive since 2002, and she is on medication to manage her hypertension. Now, here comes the main information. See here. It says that she underwent the routine colonoscopy. After the procedure, multiple polyps were found, so she was admitted at Medical Center, Brisbane on August 11, 2016. Then, after 2 days, she underwent polypectomy on 13th August 2016. Initially, she was at recovery room after the surgery. There, she developed some post-operative complications such as respiratory distress. Then it says that the ABG revealed she developed metabolic acidosis. So, she was transferred to ICU to treat the same and moved back to the regular ward on 15th August 2016 with the support of oxygen. Initially, she was not really cooperative and she required encouragement to take the medication. Then, she felt difficulty in sitting and she could not walk around the room Then we can see that the pain medications were given, such as paracetamol and Indone, to manage her pain. Moreover, she was on Foley catheter, but now she is on adult diapers due to urinary incontinence. Down we can see that the pain is moderate now and the wound with no exudates. Now we can see the nursing management. On August 17, 2016, the patient was little hesitant to ambulate around the room, so she preferred to walk with assistance. And it says that she was anxious during the wound dressing, and now she is only minimal pain at the incision site. And she was encouraged to stand, sit and walk inside her room. Moreover, she had poor appetite, then her constipation resolved with laxative. Now let's see what happened in August 19, 2016. Here we can see that Miss Marshall's condition has improved a lot because she can walk around the room with walker, and she can also walk along with corridors, and she feels uneasy during dressing changes, and her appetite also improved. After 3 days, on August 22nd, 2016, she was able to walk with cane, and she needed only less oxygen, and her pain is reduced again. Now it is minimal pain on the incision side, and her bowel movements are regular. However, she still requires adult diapers to manage her incontinence. Now, she is eager to go home, so the discharge will be initiated once the oxygen availability at home is confirmed. So we can see a gradual improvement in patient's condition. On 17, she had lots of difficulties, but on 19, we can see that her condition has improved a lot. And on 22nd, we can see that she improved again, and she was ready for the discharge on 23rd. Here it says that home medications and instructions were given in the presence of her son, and the importance of transition care program explained, which includes the continuation of dressing change at home. Moreover, she was also advised to monitor oxygen consumption. Her follow-up checkup has been scheduled on 30th August 2016. Okay guys, now let's see how we can write an OIT letter based on this case note. Thank you.